Chapter 13, Procedural Coding. The objectives for Lesson 13 are as follows. 1. Explain the purpose and importance of coding for professional services. 2. Define terminology used in the current procedural terminology, the CPT. 3. Demonstrate an understanding of CPT code conventions. 4. Discuss the format and content of the HCPCS and CPT code books, including Category 1, 2, and 3 codes. 5. Interpret the meaning of CPT code book symbols. 6. Identify and discuss the complexity of evaluation and management, the E&M service codes. 7. Explain the surgical global package. 8. Discuss the sections of the CPT book. 9. Explain current usage modifiers in procedure coding. 10. Explain various types of code edits. And 11. Explain how to choose accurate procedure codes for descriptions of services and procedures documented in a patient's health record, including discussions on bundled codes, unbundling, downcoding, upcoding, and code monitoring. And 12. Describe various methods of payment by insurance companies and state and federal programs. Understanding the importance of procedural coding skills. Procedure coding is a transformation of written descriptions of procedures and professional services into numeric designations, which are code numbers. Procedure codes are a standardized method used to precisely describe the services provided by physicians and allied health professionals. The CPT book is published annually by the AMA. Procedure coding is the services rendered to the patient during the encounter, whereas diagnose coding is for the conditions described as to the patient. Current procedural terminology, the CPT. The CPT is a 5-digit system for coding services. There's 2-digit add-on modifiers that are placed after the usual procedure code number to indicate a procedure or service has been altered by the specific circumstance. It represents the diagnostic and therapeutic services, and it's a system of choice from Centers for Medicare and Medicaid Services, the CMS. There are 3 levels of CPT terminology. Level 1, the American Medical Association, the AMA, CPT codes and modifiers, and this is your CPT manual that you will use most of the time. Level 2 are your national codes, your HCPCS, and CMS designated codes and alpha modifiers, which are your national codes. And then level 3, codes are specific to regional, fiscal, intermediary, or individual insurance carrier local codes, and not found in either level 1 or 2. CPT codes are used for services that are provided. HCPCS is used for supplies or durable medical equipment. Private insurance companies may not accept level 2 HCPCS codes for submitting insurance claims using level 2 HCPCS codes. ABCs are used for services that are considered alternative or complementary medicine. What would be an example of such service? That would be acupuncture, osteopathic medicine, etc. Alternative billing codes. ABCs are 5-character alphabetic symbols with appended 2-character practitioner modifiers that represent the practitioner type. Integrative healthcare is care that incorporates the best approaches from conventional and complementary and alternative medicine. As of October 16, 2006, Alternative Link discontinued its pilot study. ABCs may become mandatory. Numerous payers are in the process of implementing the ABCs for payment. Methods of payment. A fee schedule is a listing of acceptable charge or established allowances for specific medical procedures. The UCR, which is usual, customary, and reasonable, uses 3 fees to determine reimbursement. RVS uses units based on the median charges of all physicians during a given period. And a conversion factor is used to translate the units into dollar fees for each service. Resource-based relative value scale. The RVS is a coded listing of procedure codes with unit value to indicate the relative value of the various services performed, taking into account the time, skill, and overhead costs necessary for each service. The use of RVS codes may be required in some states. The RVUs are based on the physician's work, RVU, the practice's expense, RVU, and the malpractice insurance, RVU. A geographical factor and a conversion factor are used to convert the RVUs into dollars on the Medicare scale. Format and content of the CPT book. The existing CPT codes that you use are the set Category 1. Category 2 codes describe clinical components that typically may be included in the E&M services or clinical services and do not have a relative value associated with them. Category 3 codes are a temporary set of tracking codes used to code emerging technologies that do not yet have any procedure code assignment in Category 1. Each main section is divided into categories and subcategories. Evaluation and Management section. E&M codes describe physician services involving the E&M of a patient problem. It's divided into 3 sections. The difference between new patient and an established patient is a new patient has not received professional service from a physician or a group practice in the last 3 years. An established patient has received professional services from a physician or a physician's group practice in the past 3 years. Then you got your hospital visit, which your initial and subsequent, and then consultations. The elements of the E&M codes. History, examination, and medical decision-making are considered key components of an E&M code. The nature of the presenting problem, counseling, coordination of care, and time are considered contributory factors. Subsections of the E&M. For hospital inpatient services, the physician includes the services related to the admission that were provided in another setting, such as the ED. What is a consultation? Those are services rendered by a physician whose opinion or advice is requested by another physician or agency in the evaluation and treatment of a patient. Critical care is the direct delivery of medical care by a physician for an actual critically ill or injured patient. Time is a key factor in critical care codes and must be documented in the patient's record. The same definitions for critical care services apply for an adult, a child, a neonate, despite the separate section for pediatric and neonatal critical care. Emergency care could include services rendered in an ED or emergency visit in a physician's office. Types of counseling may be considered preventative medicine as well. Selecting an E&M code. Documentation must be reviewed to determine the key components and the contributory factors. There are different levels to indicate the complexity of an office visit, such as 1 is the least complex, where 5 is the most complex. The surgery section. Always start with the operative report. Assign code for postoperative diagnosis and assign codes for the additional diagnoses. Attach the documentation to the claim form. Code only documented procedures. Confirm all diagnosis and procedure codes, and be sure to use the appropriate modifiers. The surgical code descriptions may define a correct coding relationship wherein one code is part of another based on the language used in the description. Your surgery services. Never event. Transfer to another facility. Follow postoperative days. Repair of lacerations. Multiple lesions. Supplies. Incident to services. And prolonged services, detention, or standby. Now, some other incident to services would include rechecking a patient for conjunctivitis, checking blood pressure for a patient being treated for hypertension, checking a wound beyond the global period, and recheck for issuing a return to work certificate. Surgical package for non-Medicare cases. The entire surgical package will be covered by one fee, and that will include the operation, local infiltration, which is topical anesthesia or metacarpal, metatarsal, or a digital block. Subsequent to the decision for surgery, one related E&M encounter on the date immediately before or on the date of the procedure, including history and physical. Immediate postoperative care, including dictating operative notes and talking with the family and other physicians. Writing the orders. Evaluating the patient in the post-anesthesia recovery area. And typical postoperative follow-up care, such as hospital visits, discharge, or follow-up office visits. Unlisted procedures. These are codes that are assigned for unusual procedures. Supporting documentation is required to justify the procedures. A comprehensive list of unlisted codes is at the beginning of each section. But remember, some payers do not reimburse for unlisted procedures. You want to check your guidelines before submitting claims. Comprehensive and component edits. These are code combinations that are specified as separate procedures by the CPT. Codes that are included as part of a more extensive procedure. Code combinations that are restricted by the guideline outlined in the CPT. Or component codes that are used incorrectly with the comprehensive code. Mutually exclusive code edits. These are code combinations that are restricted by the guidelines outlined in the CPT. Procedures that represent two methods of performing the same service. Procedures that cannot reasonably be done during the same session. And procedures that represent medically impossible or improbable code combinations. Coding guidelines for code edits. Code editing. It's a computer software function that performs online checking of codes on an insurance claim to detect unbundling, splitting of codes, and other types of improper code submissions. The best way to telephone the third-party payer to inquire about new coding options and to note improvements in reimbursement. Your National Correct Coding Initiative edits are updated quarterly. Bundling. Bundling is to group codes together that are related to a procedure. Unbundling is coding and billing numerous CPT codes to identify procedures usually described by a single code. Unbundling is considered fraud if it is done intentionally to gain increased reimbursement. The use of outdated codes often inadvertently results in unbundling. Downcoding. Downcoding is when a coding system of an insurance carrier converts a code to reduce the level of codes on an insurance claim. To prevent downcoding, make sure that the documentation from the provider supports the code that is being submitted. Upcoding is deliberate manipulation of CPT codes for increased payment. It is illegal and it can be considered fraud or abuse in an external audit. Helpful hints in coding. Office visits. Be careful with assignment of the appropriate E&M code for standing orders. Some insurance policies only allow 2 moderate or high complexity office visits per patient per year. Contact the insurance company either online or by telephone to validate whether the patient has insurance, as well as to learn if there are any limitations. Drugs and injections. You'll need to know the name, the amount, the dosage, the strength, and how it was administered. Roster billing for mass immunizations for Medicare patients. Now, a roster would include the Medicare patient's identification numbers, the name, the addresses, dates of birth, genders, and signatures when they received the vaccinations. Adjunct codes. They identify special services and reports. Some circumstances that are covered by the adjunct codes are handling of laboratory specimens, telephone calls, seeing patients after hours, office emergency services, supplies and materials, special reports, travel, and educational services rendered to patients. Also, basic life or disability evaluation services. Code 99450 is life or disability insurance, and codes 99455 and 99456 are work-related or medical disability examinations. Code modifiers. The code modifiers can indicate a service or procedure has either a professional or technical component, a service or procedure was performed by more than one physician or in more than one location, a service or procedure has been increased or reduced, a service or procedure was provided more than once, only part of a service was performed, an adjunctive service was performed, a bilateral procedure was performed, or unusual events occurred. And remember, a modifier is necessary when circumstances in which a procedure is performed different in some ways from that described in its usual 5-digit code. With the code modifiers, there's a complete description of what the modifiers are in the Appendix A in the CPT manual. Modifier 22 is the increased procedural service, and this is the most overused and the one that would cause the most audits. Modifier 25 is significant, separately identifiable in evaluation and management service. Modifier 26 is a professional component, and that is an example of that is the taking and interpreting of a radiograph. Modifier 51 is multiple procedures. And an example of that is when more than one surgical service is provided on the same day or in the same surgical section by the same physician, such as an excision and biopsy. Modifier 52 is reduced services. And modifier 57 is this decision for surgery. Modifier 58 is staged or related procedure. Modifiers 62, 66, 80, 81, and 82 are more than one surgeon, and modifier 99 are multiple modifiers. Healthcare Common Procedure Coding System. Your HCPCS Level 2 modifiers may be used by some commercial payers. 2 alpha digits, 2 alphanumeric characters, or a single alpha digit. And remember, there is a brief list of modifiers found in Appendix A of the CPT book, and then a comprehensive list may be found in the HCPCS National Level 2 Code Book. And this completes the lecture of Chapter 13, Procedural Coding.